Hi guys, Donovan Gow here, and today I'm going to talk about self-massage you can do for your neck pain and headaches. In my days as a massage therapist, I used to do a lot of neck work, and a lot of people came in with neck pain up in their upper shoulders, or they're getting migraines, headaches up around their forehead into the temporal lobes. And what I found was a lot of times the source was actually the SCM muscle. It's this big, strong muscle on the front of your neck, and you can see it here if I rotate. It goes from your mastoid process right here on your temporal bone down to your sternum and to your collarbone, so it attaches here. So what it does is it flexes your neck forward when they both work together. It flexes you forward, and it also, when one side works, it turns your head. So if you're having problems with rotation, it's tight, or if you can't get back into a good posture, oftentimes it's because these muscles are pulling things really tight up front, and it's making these muscles in the back work really hard all day long, which makes them sore. Also, these get full of trigger points, which refer pain oftentimes up into the temporal lobe and into the forehead, giving people lots of headaches. So I'm going to show you a real quick, easy routine you can do yourself that'll really loosen things up, and I do this myself pretty regularly, and it really helps. So caveat before we get started, neck muscles are really touchy. If you overwork them, they will get really sore and tense, and you'll feel worse tomorrow, and you'll be cursing me. So take it easy, maybe no more than 5 minutes aside to start, and then leave it alone for the rest of the day. And also right here, you'll see inside the muscle is your carotid artery runs up here. You can feel your pulse here, so don't press really hard on that. That will not make you feel good. Okay, so here's the routine. So to start, I'm going to use my thumb, and I'm using the side of my finger. I'm not pinching this way, I'm pinching this way. Okay, so I'm going to start up at this attachment here by my at the upper attachment, and I'm grabbing and I'm just working down the muscle. So I'm doing this kind of motion as I work down the muscle. If yours are really tight, you might need to bend your head in a little bit to give it some slack. So all I'm doing is working down in a rubbing kind of motion up and down, just to kind of warm it up and loosen up some of the tissue. I'm going all the way down to the attachment by the collarbone. So that's the first pass. Second pass, I'm grabbing the same way, up near as high as you can up here, so your knuckles almost right up under your jaw here. I'm grabbing and I'm pulling out and away. So this gives me a stretch out and away, and then I move down, pulling out and away. It looks a little funny, but it feels really good. You'll also start to notice where it really is sensitive. Like for me, I can feel it, oh, right in here, it's a little tighter. And I work all the way down doing that, all the way down to the base. And again, if it's hard to get behind it and pull out, go this way. And I'm grabbing this way. I don't want to grab like this. I really don't want to dig in behind the muscle. I'm just trying to grab it. You don't want to have any lotion on or anything like that. Do this as dry as you can, or else your fingers will slip off. So that's the second pass. Third pass, again, I'm starting at the top, but this time I'm pulling down. I'm pulling away from the attachment. So I'm pulling downward pressure. And if I want some extra, I'm going to tip my head in the opposite direction. So it's kind of like a pin and stretch. I'm pulling the muscle down and I'm stretching away from it. I move down, pull down, stretch away, pull down, stretch away. And I do this all the way down. And that is just a wonderful stretch. You'll feel the tissue getting looser as you do it. And then when you hit the bottom, you're going to reverse that. So you're going to pull actually up away from the collarbone. So you're pulling up in this direction and getting a stretch away from this attachment. So that's the third pass. And then finally, as I've been doing this, I'm looking for really sensitive spots. So I'm going to go back and look for trigger points. These are spots that are particularly sensitive or that are referring pain, that when I touch them, it feels like they're zapping me up into my head or somewhere in my jaw. So now I'm going to use my fingertips a little more, and I'm searching for those spots. For me, they're up here, and I find them It might take a little practice here because it'll roll off sometimes. I'm going to pinch on them. And I don't want it to be excruciating. Should be a little bit uncomfortable though. And I hang out on that spot and I just relax, breathe. You can hang out on that spot for 30 seconds to a minute. And you might feel some twitching going on, but it can really calm those spots down. Then after 30 seconds to a minute, I ease up. I shake it out a little bit, just lightly, and I go back to it. After I've let some blood flow get back in there, I go back to it after a few seconds and feel it again. Does it feel better or worse? You might have to do this a few times to get out those specific spots. You may have none of them, but most people have at least 2 or 3 good spots in here that needs a little extra work. So that's it. 4 passes. 1, just rubbing this way, top to bottom. 2nd one, pulling out and away. 3rd one, pulling away from the attachments, down and stretching, and then up at the bottom. And then finally looking for those spots. And then when you're all done, check out your range of motion. Side to side, and getting your chin back in a good posture. I'll bet you it'll feel a whole lot easier. So it's a great routine. I do these regularly, several times a week. You can do it in the car, you can do it in front of TV. But like I said, don't overdo it. 5 minutes aside or so is plenty, and then leave it alone for the rest of the day. So hopefully this will help you with your neck pain, and I look forward to talking to you soon. Thanks.